they may want to continue after the epidemic. It's never let a good crisis go to waste, as they say. So there are things to learn and things we will say, probably like Zoom meetings, never again. But so we want to try and tease that out. And what we are very keen to make this seminar, and this relatively small group we've got now, is as far as we can a kind of working meeting. What we're trying to do is identify good practice and lessons. And what we hope is that you'll agree to, particularly colleagues from Bristol, but others coming back to you to try and understand more, so that the product of this work we're doing is actually something that is a practical tool that NPMs can use in future, where we can learn from the best of experience that people have gained. Everybody is to some extent doing something new, and we want to try and capture that learning, so that we can take it forward into whatever, in particular, whatever the sort of post-epidemic world kind of brings. So we are really grateful to you all agreeing to do this, and we hope people will participate. It's a small group, so if you want to contribute at any time, you can do the normal hands up thing, or alternatively just turn your mic on and shout at me. That would be fine as well. So let's keep it relatively informal and kind of practical. And again, I'm conscious pretty much about half the people here are working in either the second or third language. So do, again, if you need something repeated, or if I and other people are speaking too quickly, then do slow us down and ask for clarification. We want this to be useful for everybody. And I think probably we'll get through it in a bit over an hour. I don't want to take up too much people's time, but we'll crack on. So I think Rachel's going to talk about the work that's been done so far. So over to you, Rachel.
Thanks, Nick. Yeah, so just to give a bit of a background of where this came from, I think it was back in April, May, Nick, Malcolm and myself had a conversation about what NPMs were doing during that time, and was sort of struck by some quite innovative ways in which they were managing to monitor during the first lockdown. And given the rather depressing environment in which we find ourselves in, we thought it might be appropriate to focus on the positive aspects, the sort of entrepreneurial ways in which NPMs have managed to deal with the challenges that they faced. So with the support of the Saeed Mubarak Trust, with Nick, and also with the assistance of the APT, who's been publishing a huge amount of information and from which a lot of this information draws, we came up with the idea of trying to look in the context of the SPT guidance that have been issued in April, and then just simply gather information on what NPMs were doing during this time to monitor, whether that involved still going on visits or other tools and means to try and then draw inspiration from that and hopefully provide examples for others to use. So it was based on desk-based research, key documents, all the resources that the APT have been putting out there, NPM websites, as many as we could access given sort of language constraints as well, key civil society organisations, and Debbie also spoke with a few NPMs as well. Debbie is the one who should be giving this presentation. She's done all the work. I feel bad standing here and giving the impression that I've done all the work, but actually it was Debbie, but unfortunately she can't, due to sort of emergency situations, be here today. So I'm presenting on behalf of her, but just to acknowledge the huge amount of work that she's put into this. And just to make it clear, all the information that we've got in the table that has been sent round to you is all based on publicly available information, nothing that was, got through confidential sources or otherwise. It's not comprehensive, we know that. And if there are gaps, if there are errors, please don't hesitate to let us know. We consider it a working document, so I'm sure there's many examples of innovative practice that are not there and that will be created in the next few months. And we recognise we're not trying to suggest that these methods may work in every country, but that they're a sort of toolkit from which people can draw if they have some inspiration and they think it might work. So I'm going to give a very brief summary of some of the sort of headline things that are coming out of what we found before I hand over, I think, to Alexis to talk more about some of the examples that they've discovered, and then to hear from all of you. So there are clearly NPMs that have continued to do visits, and what they've done is to either refocus the type of visit they've done, so do a sort of short targeted visit. I think New Zealand is an example of that. Change the methodology, for example, have less people on the visit, change the criteria of prioritization, or the focus of what you're looking at. So some NPMs looked more at overcrowding, for example. Some focused on particular establishments, such as for older persons or those with disabilities or vulnerabilities or care homes. So their visit still took place, and then it was an issue of protecting those who were conducting those visits through the appropriate personal protective equipment, reduction of numbers, reduction of time spent in institutions, and so on. But obviously visits were not possible in many instances. And then what you saw is some really quite innovative practices of undertaking virtual visits. So through confidential interviews with staff and prisoners, using video footage and photos and so on. There's examples from Australia. Unannounced monitoring calls to detention facilities. The Independent Custody Visiting Association in England is a really interesting example of this. Regular forms of checking in through sort of phone calls, other forms of communication with staff and with detainees and with members of their families. And then new ways of gathering information, such as setting up of hotlines or helplines or free phone lines for detainees to record complaints and other issues. And then also, interesting example, the Office of the Inspector of the prisons in Ireland, with a journal given to prisoners for them to record their experiences. And I'm sure much more can be said by others about that here. There were some quite creative ways of accessing existing data. So sort of dip checking for custody records, accessing performance data, using other data such as prepared on COVID cases across institutions, and developing memorandum of understanding for sharing data between different monitoring bodies. There was increased contact with authorities, either with the staff in these establishments, video conferencing calls with them, or an agreement to share information. Another trend that you can see is a increased focus, I think, on the non-visiting aspects, the preventive mandate. So many NPMs focused on policy and advocacy, producing reports and commentary, particularly on underlying issues that have been exacerbated by the pandemic. So overcrowding, early release, hygiene, food and water and access to conditions, and contact with family and others. And there are quite a few NPMs that have published reports on these sorts of issues. You also see increased engagement or additional engagement with civil society organisations, where resources are shared or ideas or intelligence is shared. So you've got, and the APT have got these great podcasts, I think, which illustrate some things in relation to Brazil and Togo as really great examples of how they've engaged with civil society. And we understand that in Lithuania, the Ombudsman tried to find an additional way of gathering information about social care homes through the use of a private Facebook group where they could collect information on the conditions and good practices and so on. And one of the final points is that you do see additional ways in which NPMs are supporting each other. So there's more regular remote meetings, and we've heard examples of where that's been particularly helpful. They've reflected internally and provided training internally on how to monitor during the pandemic. There's been community hubs set up online to sort of share ideas and resources and discussion. There's been an attention on trying to ensure that any who are doing visits get the appropriate PPE, but also that they gain key worker status so they are able to go out during lockdown periods. So that's just a snapshot of some of the things that we found. As I said, we haven't at this stage attempted to make any evaluation on whether this is good or bad practice or things that need to be continued on post-pandemic. And that is the idea for the next stage. I think there is some interesting lessons here for quick, low-tech, cheap methods of prevention that can clearly be of use in the future. But I think some more forms of evaluation need to be conducted to ensure that not certainly from state authorities, they're not pushing the more efficient or cheapest way of monitoring for convenience, and that it's actually good practice in terms of preventive elements and a preventive approach. So I'm going to stop there and hand over to others who have much more detailed information to provide. Thanks very much.
Yeah, thanks very much for that, Rachel. And I think there's a lot of really interesting information there. And I think your point about making sure that some of the good practice then doesn't become an excuse to do this on the cheap for states, I think is a point kind of well made. I want to hand over to Alexis now from the APT. I have to say, I think as usual, the APT website and resources they produced are simply fantastic. Obviously, I do, I'm not saying that to flatter. It's such a rich resource, I think, and so sort of global in reach. So do you want to, so it'd be really helpful, I think, Alexa, to hear a bit about some of the APT's experience and what you're picking up from what's happening on the ground. So thank you for coming, Alexa.
Thank you very much. And thank you for having us, and thank you for your kind words. It's always nice to hear feedback on the work we do. And it's true that we've put a lot of effort into trying to support NPMs as much as we could in this very difficult year for everyone. And something that has come up repeatedly before, but in 2020 even more than ever, is really that appetite for peer exchange and experiences from others who are faced with similar challenges. And so that's really what we've tried to facilitate. And using those various platforms and opportunities for exchange to also feed our own reflection on how we can be as useful as possible in supporting NPMs. So we did create, for example, this platform on Slack, where all of the NPMs have been invited, all the ones we had contact with. If you know of NPMs who are not part of this and they would be interested, we're obviously more than happy to invite them. And so they've been able to exchange directly among themselves and with us on this. We've also really, wanted to, as much as possible, amplify the voices of NPMs that we thought were, having what we like to call promising practices rather than best practices, because as Rachel pointed out, we don't have enough hindsight to be as final in our judgment. But so with this Voices from the Field video series, we've done some of that. We also had a number of expert webinars where we invited experts to share their expertise and NPMs to exchange. We've also sort of mainstreamed this approach into other aspects of our work. So for example, earlier last month, I was lucky to actually travel to Rwanda for a mission. And before traveling, we organized an online training in which we invited other NPMs to actually share their experience. And we've seen that we've had really not only great responses, but a growing appetite. And I think that COVID reality has really reduced the distance that some NPMs see as existing between them, and that's very positive in our view. A point I think I'd like to make as well on advocacy. You mentioned earlier that not let a good crisis go to waste, and I think that that this crisis has brought about really great opportunities for advocacy, putting, attention on issues that were always there but have taken a whole new dimension, and states seem to be listening a bit more, be it on overcrowding, on alternatives to detention, and all of this throughout the criminal justice system, which is also something that we saw some NPMs may not always have a vision that is, throughout the criminal justice system, and maybe this crisis brought these connections a bit, to light. And finally, maybe a couple of examples that I find particularly interesting. One that was from the Georgian NPM, which was in monitoring centers of quarantine, which is also, with this new places of deprivation of liberty have emerged, and using social media. Rachel mentioned private groups, but they went in so far as to, together with someone who was in that center, with a Facebook Live, do sort of a live visit and interviews of those centers. So that's something that we found to be quite interesting. And one response that we saw in Brazil to the risks that the remote interviews can have for the detainees, around privacy, of course, was the development of a quite long and comprehensive questionnaire by which the detainee on the phone could only answer by yes or no, and therefore shielding them from any risk of repercussion, because they were not actually giving any information on their end. They were only saying yes or no to a number of detailed questions. So that was something that we saw that we thought was particularly interesting. And I'll stop here, but I'll be very happy to continue participating in the discussions. And thank you again for the invitation.
Thanks for that. That sparks a lot of kind of thoughts for me at any rate. And I think one of the features of it is the extent to which the sort of technology can be used, and how you might then, what you might need to do to protect people from harm, and the extent to which the technology can enable NPMs to work together across continents, really, in a way that probably wasn't, well, it may have been possible before, but we weren't doing, perhaps. So there's lots of things there, what you say, Alexis, that I think we'll come back to. What I want to do now is kind of open some of these points up for discussion. What I would suggest that is the way we do it is try and break it down roughly into some topics. So I thought maybe to start with, it would be good if people were willing to share their experience of visits, either in person or remotely, about what's been people's experience of that, particularly looking for good practice, and then looking at to what extent people have extended the preventive mandate more broadly in the way that Rachel was discussing earlier, talking about, thirdly, talking about links with other parts of civil society, and finally maybe talking about, we've got Daniel and Malcolm here from the ESPT, coming back to them from their perspective and links with them. But first, maybe it would be good to hear some practical examples for people of how they've actually been carrying out visits and they've adapted their visit methodology, whether that's actually been visits in person or whether that's been some of the examples of remote monitoring that we've been hearing about. It's always difficult to get someone to kick off with these things. So I'm going to ruthlessly pick on somebody who I know has been doing it, and that hopefully will encourage the others. So Himpal, do you want to say a bit about what you've been doing in the UK to kind of kick things off?
Yes, sure. I'll just get the kettle turned off first. Sorry, you caught me on the hop. Yeah, so we right at the very beginning of the pandemic, we were concerned about, like anyone, we were concerned about going into prisons because of the risks of infection, and we were really quite reticent about making a start on monitoring. But by the time that April came around, we'd completely changed our minds, and that was partly because we were concerned about the stories coming out from prisons about how long people were being locked up for, but also refreshingly, I think, partly because we knew that prisons themselves wanted some assurance that they were doing the right things. and they were taking some really quite extreme steps, and were keen for us to come in and provide some kind of independent oversight and tell them if they're going too far, but also critically reassure them if they were doing things which were reasonable and legitimate. So our approach, which has evolved over time, started off as what we called short scrutiny visits, and we went to 3 prisons or immigration detention sites in the course of just one day. That compares normally to spending up to 3 weeks in an immigration detention centre or 2 weeks in a prison. And we only took 2 or 3 inspectors with us, including a health inspector. So that's now evolved over time as we've seen risks reduce and risk management become more sophisticated to what we've unimaginatively named scrutiny visits. We just dropped the short. And that entails 3 days on site in prisons with up to 6 or 7 inspectors. And that's worked very well because it means that individual establishments have had more in-depth scrutiny. And we've been able to not just look at how they've been managing a crisis, but also to go into a bit more detail about how some of the fundamentals are being adhered to. So, of course, we wanted to see if they were managing the risks of the pandemic, but we also wanted to see if the most fundamental basic things were still being done. So, were prisoners being safeguarded? Was self-harm being monitored and responded to? Was use of force still being overseen by managers? Were all those kind of basic elements of a decent prison being conducted? Because we didn't think we could possibly encourage anyone to feel they could have a pass on those really important fundamental issues. And I have to say the response to that work has been incredibly positive from the prisons themselves. They were really keen to get us in. The feedback on the visits has been surprisingly good because they we hadn't realised how uncertain they were about what they were doing, and it's helped them to change, to progress, to move on, and they've responded to some of our feedback. So that's very positive. Just one final thing I wanted to throw in. Listening to the presentations earlier on, I was struck by this idea about monitoring from off-site. How can you safely undertake monitoring and find out what's going on? One of our big learning points, I think, is that there is a tremendous amount you can learn without setting foot in the prison, but you must go into the prison at some point because we have a very cooperative prison system here, and they have provided us with full access to their databases, so we can access their data, their data from prisoners, and all of their other information about what's happening across the prison estate remotely. And and we've been doing that in a much more focused way. But there's no substitute for being in the prison, drinking in the atmosphere, understanding what's happening around you, and critically speaking individually to prisoners. About half of the prisons in England and Wales now have in-cell telephones, and we never used those before to any great extent. We are using them a lot now. So routinely, every time we go into an establishment, we will phone about a dozen prisoners, especially those who are isolating, and simply find out if they're being treated adequately, how things are going, and of course we can do that reasonably safely from an office somewhere. So yeah, there's been a lot of learning, and we're still learning as time goes on about how best to implement this new methodology.
Okay, thank you for that. It would be good to hear from other people who've done on-site monitoring, particularly in other regions.
Could I have just a few more information on how you did this phoning in and how you did face-to-face interviewing in these times?
Yeah, go on.
So, yeah, sure. So the phoning in, it's possible from a prison wing. You can go to an office and you can phone each cell from that office, as long as the prisoner's got in-cell telephony. And sometimes you can do it from a different office in the prison. Unfortunately, you can't do it from outside the prison. That's the difficult thing. Because
is it the interphone system with each cell?
Yeah, each cell has a phone. Yeah.
But a phone in the phone then, or an interphone?
No, it's a phone.
No, it's a proper telephone. Yeah.
Okay.
So they can receive calls from outside as well, from family and friends. But you know, as long as their number is approved, so that works. As long as they have a cell phone. If they haven't, then of course it's much more difficult. And the second part of your question was about face-to-face interviewing, and of course we were very concerned about doing this safely. And initially we didn't do any to start with, and within about a month we started doing a lot more, because we saw that for a start there were fewer prisoners out. It meant that we could see people on the wings and maintain distance, or when they're outside we would go and speak to them there. So the people we've avoided completely are those who are isolating because they're freshly into the prison, or because they have symptoms, or because they are shielding. So we've almost never seen them face to face. If we can't speak to them on the phone, then we've worn PPE, so the shield, the mask, and the gloves to go and see them.
Okay, thanks. It would be good to hear from people in other regions who've conducted face-to-face visits, or indeed how people have been able to do that with other settings apart from criminal justice settings, about psychiatric hospitals, that kind of thing. It would be good to hear. I know that I think we're joined by our colleague from Chile now, Andrea. I think the Chilean NPM I think has done face-to-face visits. Are you able to tell us something about how that's worked?
Hello everybody. Well, no, not really. Can you hear me?
Yes.
Yeah. Well, we are just starting with the mechanism here in Chile, so now I have joined this meeting to hear and learn, basically, because we still haven't conducted any visit inside. We're just starting, and so I'm not able to report about any visits yet.
I'm sorry. Okay. It's important. What about others then who have done face-to-face visits, or if they haven't been able to do that the remote monitoring people have managed to do?
Unfortunately, Nick, we could not have Georgian NPM. They were connecting and dropping. I think it's a connection issue, but this was definitely one of the interesting examples of keeping the visits during the pandemic and lockdown.
How people then, if they haven't been able to do face-to-face visits, how have people managed remote monitoring in view of the kind of things that Himpal was saying about, you don't have the same insight, I suppose, if you're not there in presence, in person. I wonder if people have got any experience they could share with us of how they've done more remote monitoring. Good. Fantastic. Thank you.
Earlier in the year in Ireland, I'm sorry, I don't really know how to raise the hand, so I did it like this way.
Yeah, it's very good. I get the point. Anything will do. Go on. That's
well, we did the face-to-face meetings in Luxembourg. I went first in March to the prison, to the direction of the prison to meet them, so they could explain me how they would like to manage the crisis. And then I have to say that most prisoners did accept the measures, the restrictions quite well. And well, as the crisis went on in May, I decided to go for having a meet and greet, let's say it like that, in the prison, so that they can explain what they are feeling, where are the problems, and how they were living all the restrictions. I have to say that they also had the possibility with phones in their cells, so they had an easy way of calling their family. and the prison managed to have Skype possibilities for people, so they can call their guys at home. So there were a contact with the outside, let's say it like that. And everybody could use that Skype system. Lawyers, ambassadors, they could phone me to my office with Skype. We managed also to have some Skype communications. And well, I have to say that we have only one prison in Luxembourg. Well, one closed prison in Luxembourg. And at that time of the crisis in May, there were about 400 people that were interned in prison. And I met about 80 prisoners during 3 weeks, because I was only myself doing it. I have 3 colleagues who are NPMs, but they had, I don't know the English word, but it was congé familial. So they had children at home, so they stayed at home. And so I had to do it myself, and it took me about 1 month, because it was very important for me to give them all the time they need to speak to some external person. And the problems they met were mostly the problems of meeting their lawyers, of getting contact with their lawyers, and that there were no audience at court. That was the main problems, and that they didn't know if they could have that trial in May, in June, in September, or even if they would, if the delays will run or not. So that were very, very human technical problems they had. But the conditions in prison, they accepted it quite good, because they knew it was for their safe. So they accepted of being, when there was first coming in, he was isolated, or she was isolated for 7 days, just to make sure that they had a negative test before joining the other ones. It was really good accepted by the people. It were more the problem of not knowing how it will go on. So the problem was more or less the same than we had outside. And I was free to talk to them as long as I wanted, and face-to-face was possible, because they had installed tables with plexiglass separating both of us. So I really could have face-to-face without masks at that time. So it was a quite good contact, and they managed really good here in Luxembourg. Now we have reinstalled visits also for the family, but also with plexiglass. That's a little bit different,
I think it's interesting just hearing about some of the kind of fairly small technical things that people have done, like kind of screens or whatever, that have made a difference. That you think, well, that's really obvious, but some places are doing that and others aren't. I think Patricia from Ireland was going to talk about the experience there. Patricia.
Thank you. I suppose we haven't had the opportunity to have too much on-site work during 2020, purely from a resource perspective. But earlier in the year, I spent 3 days in one closed prison, just after we went into our first lockdown period, our level 5 period. And that was particularly interesting. I visited all areas of the prison, including those who were in isolation, quarantine, and what we refer to here as cocooning. And I wore appropriate PPE depending on the level at which each of the prisoners were at. I think the fact that the healthcare background assisted somewhat in that regard. The prison itself was a little bit reticent initially on arrival, but when they handed me the PPE and saw me donning it instantly, appropriately, they said, "Oh, you've worn this stuff before." So I think that was, of some assistance. Let's put it that way. The main challenges for the people in custody in that particular prison were similar to those that Claudia has identified. There were concerns about accessing their solicitors, that their calls weren't sufficiently long to be able to engage meaningfully with their solicitors. And there were also concerns about court delays, as whilst appropriate arrangements were being put in place for court cases to take place via video link. So they were particular challenges. But also then we issued journals to prisoners in 7 of our closed prisons, and asked them to complete them if they felt that they would like to, and they could either write or draw or whatever at all they wanted to do with them. And that was particularly interesting. It was at the early stages, so many people, their concerns weren't really about themselves, they're about others. They're about their families at home in the community, and they're concerned that they might contract the virus. And at that stage, you know, the feeling was, well, we're safe. There is no virus in this prison at present, or in any of the 7 prisons. So we're safe, that their families were concerned about.
Yeah.
Simple things that they, on the one hand, appeared simple, but when it was fed back to the prison system, they certainly took it on board and have changed it. So crockery and cutlery was removed from prisoners, and their meals were provided in takeaway cartons. And the amount of prisoners who said that they really felt that was undignified, and it went to the core essence of respect, and they felt that simple mechanism in terms of how they received their food was quite disrespectful. And that was fed back to the Irish Prison Service, and they subsequently removed. It did take some time, but they resorted back to the use of crockery. So a lot of the changes that were made were from the prison side were very, very simple. And the IPS would have said, gosh, we didn't realize this was going to have such a big effect. Also then, in terms of remote monitoring, we developed a standardized template, and initially it was weekly telephone calls with the governor of the prison for information. However, I'd like to think that all of the information we got was accurate, but I do take the point that was made earlier on. I think there's no substitute for actually going into the prison to be able to substantiate the information that is provided, because on a number of occasions we would have received information that indicated certain activities were taking place, whilst we would have also received information from concerned relatives who would have contacted us directly with contrary information. So I think from the remote monitoring perspective, that is a challenge in terms of getting the balance right. But that was our experience this year so far anyway.
I think that personally, I think the idea of the journals is really interesting, because it does seem to be that would give prisoners a chance, the ones who are literate, of course, to be a bit reflective maybe in what they're saying, that perhaps a normal interview wouldn't give them the chance to do. So I think that would be, is that a sort of standard format, the journals, that you could share with people, Patricia?
I can certainly share it, but we didn't want to be directive. So literally it's blank pages. We gave lined pages for those who wished to write. And we gave, blank pages then at the end of the journal for those who wished to express themselves through art. And some did both, and some chose one over the other. The only instruction we gave was that when they felt they would like to, we left the journal with them for 14 days. So when they felt that they didn't have to write in it every day, they didn't have to write in it for any specific periods of time, but whenever they felt that they would like to communicate with us, that they could do so. So it was really very much free for them to contribute in whatever way they wish, but we're certainly happy to share that.
I think that'd be quite an interesting thing to see, because I think, again, that's one of the ideas that might have some lasting value. Then I think next is Anna. Anna, go up from Armenia.
Okay.
Right.
If I'm going to divide the year in 2 halves. In the spring, we conducted a series of very brief, very quick visits to all sorts of places of detention. We visited the place of immigration detention, some prisons, childcare institutions, and social care institutions too. This was really conducted in a very brief manner. All these visits were also previously announced, which is something that we haven't done before, but this time we chose to announce it to the directors beforehand. We were wearing the PPEs, always based on the standard of level that were usually used in those places of detention too. And after the series of visits, we visited altogether 12 different institutions, and we issued a press release too. And for the autumn, we conducted only three visits, out of which one was a follow-up visit to a detention center that was visited in the spring. And that was a very interesting particular case, because it was the detention center for the migrants, but the center was the preventive quarantine. So all people who were apprehended were automatically put into the preventive quarantine. So we had to wear all those really specific PPEs with that hazmat suit, etc. But this time, one of our colleagues had already been COVID positive. So we used her as the main person who could interview the people who had the suspicion of having COVID, because there was a bit of guarantee that maybe she wouldn't really catch it. But I have to say that this was very sensitive issue, because we were wearing all those protective equipment, and it was the same as the staff of the detention center, and it's very difficult to create the atmosphere of trust, because for them we were the one of the many who were there. Yeah. And for the remote monitoring, we established some kind of a hotline. We issued a press release to really inspire people who are in the centers just to not be afraid to call us. But to be honest, I'm not sure about the efficacy, about whether it's really used or not. I cannot really say. Yeah. Thank you.
Okay. No, thank you for that. I think, again, I think there's quite an interesting point there about your protective equipment and that looking like, then you start to look like the institution staff. And then maybe that's again something to think on. And if we are having to do that for a long time in the future, maybe we need to think about the design of that equipment or how it's the colors or whatever. So actually we are distinguished, or NPMs are distinguished from institution staff. I wanted just to, don't mean to pick on people, but I wondered whether Hatem would be able to say anything about he's aware of the experience in Africa, if he's still with us. He might have just disappeared, obviously, but, oh no, you're still there, Hatem. Are you able to say something about the African experience? Because I'm conscious that so far we've talked about quite, on the whole, well-resourced European NPMs, and I'm interested to get a...
Yeah, as you know, the situation in Africa is different. The pandemic, as I can say, is not, the victims are less,
yes,
but the monitoring of the situation is so difficult, because since mid-March, we could not move. And we don't know next year what will be the situation, because our budget in the African Commission is less than 40% now, and we cannot move. So how to monitor? So now we are looking for partners everywhere, for the national institutions, for the universities, to monitor and to give information to the Commission. So then we can talk to the governments, to the responsible everywhere. But this is difficult. It's difficult. And you know, not in prisons only, but even in the society. You know, when the governments decided the curfew and lockdowns, there's what I can call the small corruption. You know. So this is difficult, and we had some very bad situations. For example, in Uganda, some women dead because the police don't get them the authorization to go to the hospitals. In some other countries, some people cannot eat, and in many countries, you know, the poor people have to go outside every day to get their food and so on. So the situation is so difficult, not only in prisons, but as I say, the problem now is how to monitor without going everywhere. So any commissioner didn't move since last April. So this is the situation now for human rights in Africa. But in some countries, the civil society is active and can help us and can help the populations. This is the general panorama in Africa now.
Thank you. I mean, I think that's a useful kind of corrective almost to some of the other things that we've been talking about. I wonder whether at this point I could bring in either Daniel or Malcolm from the SPT and about the extent to which the remote monitoring is perhaps an answer to some of those states where even in the best of times, in person, the practical obstacles to in-person monitoring because of the distances and the travel and all of those sorts of issues make it very difficult. So maybe remote monitoring is an answer to some of that. So I don't know whether Daniel or Malcolm from an SPT perspective have got a view on that. Better pick up.
Happy to start, and I'm sure Daniel will have other things to add for sure. You know, I think, you know, this is a hugely interesting conversation because, you know, these are all issues that in both in point of high principle and practical detail, I know that, you know, we are all wrestling with in different ways and in different contexts. And I stress the different contexts because as our, you know, the last contribution, you know, to the debate, you know, reminded us we are talking certainly from an SPT point of view of a huge disparity of context here about, you know, the sort of the conditions and the possibilities of in issues that people face. As regards remote monitoring, I think it's quite important to differentiate between what we might mean by this. You know, I think for us, and we've debated this and talked about this quite at length in the SPT in the context of our discussions with NPMs, really, I think, you know, there are two different dimensions of this. There's sort of remote monitoring, I suppose, possibly going back to what Hinpal was saying, where you can probably do an awful lot more than we've currently done that does tell you a lot that's valuable in terms of remote data collection, remote contact, etc., from a broad range of stakeholders. And one group that hasn't been mentioned yet, but I know has been quite valuable in some countries, are actually the families of detainees that some groups have been in touch with, who often will have a lot of, again, hands-on information about the reality that is going on within places of detention from their perspective of trying to get in contact too. And when that comes back to an NPM, that can be another point of triangulation, if you like, around the information that it may be receiving. But that's one form of, I suppose, remote contribution to remote monitoring. But the other, you know, is the business of just simply trying to do direct contact with the detainees through remote means, which, you know, and Daniel's already raised some of the practical issues about phones, etc., etc. You know, I suppose we just have always remained a little bit skeptical about the extent to which this is really possible to gain the sort of information that you would normally, that is not normally, it's clearly not normal, but would be sufficiently reliable. Now, once again, this is possibly because of context, because in so many of the countries in which, you know, we carry out our own visiting in many NPMs work, the extent of corruption within prisons, inter-prisoner violence, prisoner control, etc., within the cells is such that, you know, even when they're talking directly, you know, on phones, and I suppose I was having this reflection listening to Patricia and the business about journals, you know, to what extent would they be able to keep them confidential, not necessarily from the authorities, but from other fellow detainees, who in many situations are actually at least as big a source of potential problems and source of ill treatment as indeed are the authorities. And so, you know, it's very difficult, you know, I think in some of the contexts in which we work, to be able to think that we can use remote means reliably without, should we say, potentially putting people, you know, at risk, you know, and it's always a difficult balance to strike here. But that doesn't mean that it can't be a valuable supplement in other contexts. And I think it does really have to be an assessment by each NPM, each inspectorate, about what can work on the basis of the knowledge of their jurisdictions and the level of trust and confidence they have that it can deliver, you know, helpful information, you know, in the context in which they are. But having a greater reliance on shall we say, the use of technology for off-site interrogation of, should we say, other aspects of institutional life rather than direct contact with the detainees. You know, I think this is, again, one of the big, should we say, takeaway points from this, certainly for us, but I think for many others. There's a lot more we can do far more efficiently and effectively this way.
Yeah, thanks.
Would you like to add to that?
You'd add to that, Daniel?
Yeah, I think the situation with the SBT is quite difficult in the sense that we have teams which are made up of different continents, that people have to move from one continent to the other to form a team and to go and to go for monitoring. That's for me the most difficult situation which we faced in the beginning of the pandemic, and I don't see how the SBT is doing any remote monitoring in the current organization of the SBT. That is really for me a task of the NPMs, and a very important task, whichever means they can use to do such a monitoring. However, I am quite interested in Hind Palbui's experience and the HMIP's experience in using these phones. I mean, we were discussing when preparing some visits the use of this kind of instruments when they are supplied by the prison administration. To what degree are we sure that it is not used for background control? Do we have our own means to have such instruments? That I really would be interested in knowing how these phone systems are used in different countries, if they are used in different countries. And in many countries, of course, they are no such things like phones where you can have individual communication with detainees. So I really see there major difficulties in carrying out the visits by the SBT. And the same relies to the face-to-face discussions we want to have with detainees when using full gear PPE material, which is for me the astronaut going into prison. I mean, I don't know how you can, if it is a hospital situation, okay, but if it is astronauts going into the wings in order to select one or two persons with whom to speak in that gear, I don't see these as a basis for confidence building, for discussion person to person. That for a very short. So there would be a lot of things to be asked on how to conduct this remote contacts one-to-one with persons, with detainees.
I think, well, okay, thanks very much for that. I think maybe Gohar wants to come back a bit about on the, I suspect on the astronauts, maybe not. And then to Miguel from Portugal, be good to hear. So go to Gohar first.
Okay, so, sorry.
I'm sorry, I thought you are speaking with me. Am I allowed to talk?
Yeah, sure, go on.
Mm-hmm. Yeah, like Anna did, I would like to just separate different part of the year, because on spring, when in Armenia, starting from March, it was state of emergency regime, in the whole country. And in all closed institutions, this was not only prisons, police, but also social care institutions that were closed for the visitors. No family visits, a short or a long one, no person from the family. and the beginning of the year, it was very tough in the numbers of the infected people, also in not in the institutions, but generally in the population. So it was the period when we were trying to use different types of remote monitoring. So as we're an ombuds institution, we're a lot of benefiting from being also an ombuds institution, because we're getting a lot of individual complaints from places of deprivation of liberty. As in all these types of institutions, there are taxophones, and every patient or convicted or detained person there can use these taxophones. Of course, if they are calling to their families, etc., they should use cards, and they should pay for them, but not to call hotlines. And our hotline is free of charge, and they call it to us 24/7. So we were collecting a lot of information by these phone calls, and we were doing also a lot of questionnaires, a lot of interviews. But like it was told also by the others, we were getting not the full picture, because a lot of detainees, for example, were complaining about the lack of family visits, about the lack of parcels, hygiene items, etc. But we couldn't see the overall situation, how the institutions are handling the situation, whether there are quarantine cells, whether they do have PCR tests, whether they are respecting the social distances, wearing the mask, the staff, etc. So we started also using these questionnaires to the governmental bodies to ask how they are, do they have some strategies, how they are handling the situation, etc., etc. But later on, we're also starting doing face-to-face visits to places of deprivation of liberty. During one of our first visits to penitentiary institution or prison, we were doing face-to-face meeting in the yards, in the outdoor exercise yards, because we couldn't use PPI in the prison, because as it was told, we would look like an alien, because nobody in the prison were wearing, even the staff, even the doctors were not using any other PPE, like only the masks, and not in every case. So it would be, nobody would like to talk with us if we were really wearing all these strange clothes and going inside, or they could even be afraid of us because they might think that we could be dangerous for themselves. So we were doing the visits on the outside yards, but we collected a lot of information that we didn't have before, because we have seen many problems, like of not respecting the social distance, lack of disinfectants, lack of quarantine cells, lack of PCR tests, etc. So many problems that we couldn't identify with even the whole tools of the remote monitoring. But from the other hand, when we were doing monitoring visits to psychiatric organizations, here where we faced more challenges, because there are so many in Armenia. I know that in some countries this is also an issue. A lot of people are living in psychiatric organizations. They are living there for many, many years. They are very old. They have some somatic diseases, so they are very vulnerable to these COVID viruses. So in this case, we have to use these personal protective equipment. We were trying not to enter directly to the rooms, etc. We were trying to be very attentive whether some people we thought that might find frightening, might not want to talk, but at least we were trying to be to describe why we're using it, etc., etc. And a lot of issues also come up in the psychiatric organizations, because we found out, for example, that there is a case of COVID. One of the patients is infected, but there isn't a PCR test for the others. In other cases, they were not transferred to civilian hospitals because in the psychiatric organizations they couldn't get proper treatment for the COVID, etc. And another challenge that Anna, probably if I understood her correctly, she was talking also about the challenge for the NPM themselves, because as a very small NPM, we had this challenge of vulnerability of our staff member. For example, in our staff, we had a doctor who had some chronic diseases, who was vulnerable for the COVID, and we couldn't take them to the visits to the places of deprivation of liberty where those persons could be infected. So there are so many challenges during this year, and they still are ongoing. Also, I don't know what you know, but the state of war in Armenia and the whole situation coming later on. So still trying to find some new solutions, some new opportunities, and that is so interesting to listen to others, and we're learning a lot also. If that would be questions, I would be happy to answer them. Thank you.
I'm sure, like I guess the NPM in Armenia has probably had a more challenging time than pretty much any other NPM, I should think. So it's good that you could be here. Miguel from Portugal was going to speak, I think.
Okay, thank you very much. Of course, these are challenging times, and after a first period that corresponded to the first period of the state of emergency in Portugal, where we didn't conduct visits, this summer, after the end of the first emergency period in Portugal, we resumed visits, and we resumed visits either remotely and also in situ. It was a good opportunity for us to follow up a previous recommendation that we had issued for educational centers in order to improve the means for conducting remote contact between families and youngsters. So it was an opportunity for us to access to what point this recommendation was being complied with. So I could say that it was a relative success because we were able to talk with some youngsters by Skype or other remote means. We also began going to prisons again. And I should say that we have decided in the first place to have a couple of meetings with the General Directorate for Health, because we thought that would be important that we agreed on the conditions on to carry out the visits that would not pose risks for the inmates or for us. So we agreed that we would not visit the cells, the area of the cells. So we speak with the inmates in the visiting areas that are protected with a plexiglass, and we use just masks, chirurgical masks. And also we have meetings with the head of the prison and with the chiefs of security. And of course, we also wear masks in those meetings. And we also decided that before we would go into a prison, that we should be tested to COVID, because there have been some outbreaks here in our prisons in Portugal, 2 outbreaks. And we, in the spirit of the do no harm policy, we think that it could be risky to go to visit a prison. And then if there would be an outbreak, it could be said that it was because of our visit. So now we have this practice that the day, 1 or 2 days before the visits, we submit to a test, and we only go to the prison if the results are negative. So far, there has been no problems. And I would also like to share with you that for our experience, the inmates, they understand the restrictions. They feel that this is a challenging time for them, but that these restrictions are in place in order to ensure their security and their health. And I should say that we have this impression that although challenging, the spirit in our places of detention is that these restrictions are necessary. And well, this is what I would like to share with you all. I also have to apologize. I have another meeting starting in 13 minutes. So I must leave. I apologize, and I hope that we stay in contact for a follow-up of this meeting.
Thank you. We'll certainly follow this up, and thank you very much for that, Miguel. And I think that I think you make a really interesting point about negotiating access with the authorities and what's safe and what isn't, in a way that maybe NPMs wouldn't normally do, but actually in this situation on the do no harm principle is necessary. And I think that's an interesting point that you make. I'm conscious of time. I don't want to keep people too long. I think Alexis wanted to come in next. And I'm conscious there are one or two other people that we haven't heard from, particularly from NPMs. I think Anna Marenko is going to come back, and maybe Helga from Norway. So let's go to Alexis first and try and make contributions now a bit brief so we can finish not long after 5:30, our time 17:30.
Thank you. I'll be as brief as I can. No, just following up on the do no harm. I think right at the beginning we held an expert webinar with 3 medical doctors, respectively, from the International Committee of the Red Cross, the World Health Organization, and the European Committee for the Prevention of Torture. And this issue, first of all, of PPE came up, and it's very interesting that all 3 medical doctors were really looking at it from a sort of sliding scale perspective of not going in as astronauts, as Danielle was saying, but really weighing in the importance of building rapport with the people that NPMs aim to interview. And the medical doctors were saying also, well, pointing out the risks of wearing gloves, because sometimes when people like you and me who are not medical doctors and not used to wearing gloves in these contexts might have a false sense of security and not take the same precautions with gloves as they would with their hands and disinfecting them regularly. So I just thought that was also an interesting thing to point out. And all 3 interviews were converted into a podcast format and are also accessible on the website if people would like to learn more about that.
Yeah, no, thanks for that. That's very helpful. Anna.
Yeah, thank you. I just wanted to come back to the testing. Back in the spring, we also conducted the PCR tests for all our employees, always prior to the visits. But it turned out to be very costly because we did 12 visits, usually 2 to 3 employees. And after the spring period, our director decided not to do the tests anymore. That was the first point. The second point was about the vulnerability, because the NPM, the NPM team, we were quite accustomed, or we were used to the risk. We knew what we were coming into. What proved to be a bit difficult was also with hiring the external experts, because we usually have external experts in our teams, and it was much more difficult for us to really explain, and because we couldn't give them any guarantee at all. That's why I know it's a bit horrible to say, but when one of our colleagues really got the COVID, and she had a very good like she didn't have any symptoms or anything. After she got healthy, it was good that we had one person of the team who had the antibodies. That was very good for the future. Yeah.
I'm not sure that we should all try and get ourselves.
Yeah, I know. But in the end, it proved to be useful for us. That's my message. Yeah.
Good. Anne, next.
Yeah, I just want to say a couple of things about contact with prisoners. One of the things we did at the independent monitoring boards was to open up a free telephone system so that prisoners could contact us. Hinpar's been talking about contacting prisoners in cell, but we were able to provide an opportunity for prisoners to ring us directly with issues and concerns. We've had over 6,000 calls, and we've been able to thematize, the things that are worrying prisoners, which are things that you might expect. So it's been, I think, quite a useful safety valve, as well as giving us a lot of information. We've also got much more regular updates from the prison every day about what the prison thinks is happening. But I think the point that was made about being there is really so important, because since many boards never stopped going into prison, somebody always did. Most of our boards are now going, except those that actually have where there's a real outbreak. But a couple of things that we picked up only by being there was, first of all, that the prison service had extended the use of parva spray in prisons without telling anybody, beyond what had been what had been said was going to happen. And secondly, that they had also instructed governors not to record, centrally record on their central system some self-harm incidents where prisoners had made a ligature, which is obviously making a ligature is a very short step towards not being alive anymore. And those two things had happened under the radar without any public consultation or discussion, even with those bodies that are responsible for that. And we wouldn't have found that out if we hadn't actually been there. So it is that difficult balance between getting information and making sure you've got that information, but also triangulating it with what's actually going on.
Yeah, I think a very strong theme has come out, hasn't it, about the importance of on-site visits and anything else being a useful supplement, but not a substitute, I think would be the kind of key message that's come out of this. Let me just see. I'm just conscious of some people I haven't brought in yet. I want to give everybody an opportunity. Mariam, was there anything you wanted to add? I don't want to put you on the spot if you don't want to.
Gohar already told you everything about our mission, so I don't have anything to add.
And then we've got a few people here from civil society organisations. I don't know, not actually part of the NPM, but look at NPMs. I don't know whether they want to say anything, Fiona or Faith. Fiona.
No, not really. I mean, really interested. I'm particularly interested to hear Anne's contribution there on the triangulation with the work of the independent monitoring boards. That's extremely interesting. And we have reformed. So alongside all the work towards ratification of OPCAT in Ireland, there's also reform of our visiting committees that's on the agenda as well. So we're really interested in learning more about that in future. So that's all.
Always good to get an update on the progress that
well, commitments to progress, you know. We'll see.
And Faith, did you want to add anything? Not sure she's there. Right.
Can I just ask a question of Fina really quickly? Because Fina, people were talking earlier about, I think Malcolm was bringing up the role of families. And I know IPRT did a small survey of families in the COVID situation. So if there's anything, maybe insights from that or the methodology you use to access those people might be helpful.
Yeah, I mean, we wouldn't consider it a kind of a reliable basis because, you know, it was really among people who were in touch with us. And people come and tell us stories when they're already upset. So we don't get people kind of proactively coming to tell us good stories. So we'd, you know, be tempered with that. And it was very much a reflection, you know, we're asking questions about family contact. So about the video visits, about but their chief concern for their family members was about the mental health of their family member in prison, more so than the risk of catching COVID-19. So that was a concern coming up again and again and again. And and a lot of frustrations with how video visits, video calls have so the technical issues, rather than upset at not having access to the in-person visits, which is really interesting, you know, but certainly very concerned. But it was also undertaken, you know, at a point in time, so be really mindful of that. We did it in August, just as visits were apparently restarting, and then they stopped again. So it'd be really interesting to go back again. But the chief concern was the main concern was concern about the well-being and mental health of their loved ones in prison.
Yeah, and that's kind of reciprocal. Someone was saying earlier that the main concern of the prisoners they were talking to was their families outside. So it's a reciprocal thing, isn't it? Katrina.
Absolutely.
Thank you, Nick. I will take the privilege of host to make few comments, although I tried my best to give space to other people. Just few comments from civil society perspective. I think what we like about the events we do, and you know, we had 2 other very successful events together during 2020. I think it's really important that we all come together, representing different sectors and different actors working in detention places. And for us, this is really important because it's kind of working together, NPMs, NGOs, academics, because at the end, we do have one goal of upholding those international human rights standards, as I mentioned earlier. I also want to highlight one of the initiatives we put in place as a response of gathering information from families, prisoners, and prison leavers. In June, we launched a joint campaign with a few organizations working in prisons, those who could not access prisons anymore, but were receiving increasing amount of calls from prisoners as well as from prison leavers and their families. So we launched a campaign called A Record of Our Own, and we were talking to prison leavers, families, and specifically those from ethnic minority background. We were really concerned that we had no information about how pandemic was and coronavirus was affecting people from minority ethnic backgrounds, whilst on the other hand, we were hearing quite high number of people from ethnic minority groups being affected by the virus. So on the back of the lack of information, we could understand the anxiety from families. So we launched a campaign. We had over 150 direct submissions from prisoners, families, and prison leavers, and we will be reporting our findings in January, hence another webinar to invite you to share with you some of the main findings. But we find it really helpful that for HMIP prisons, we're asking, for example, using social media, specifically Prison Families Voice, and we were able to kind of identify where the visits were happening and then communicate with families and direct them to communicate with HMIP prisons, which I thought was a very good use of social media.
Okay, thanks very much. We ought to kind of wrap up now. Gone on, conscious is getting late. I just wanted, Rachel, just wanted to come back to you whether there's anything you particularly wanted to pick up as a kind of closing comments.
No, I mean, it's just been super interesting and helpful. I think it just shows, how much is out there on what people are doing. And we just hope we can capture, if not all of it, but certainly everything that's been said today. But no, thank you ever so much, everybody, for all your time in attending it and sharing all your experiences.
I think there's some really impressive, as we thought, I think there's some really impressive work on that needs to be captured. And I think we can use this experience out of this very difficult situation in a positive way to strengthen our monitoring. And as I said earlier, I think the key theme that comes out of this is about the central importance of in-person visits, but that they can be supplemented with some of the other things we've learned. I think this principle of kind of do no harm and how people have navigated that, I think is really key. And indeed in the ways that people have had to work with prison and state authorities to balance off the harm and the independence kind of principles. And I think that's been striking. What I hope people will be happy with is if now we come back to some of you individually just to follow up some of what you said so that we can go into it in a bit more depth. But for now, once again, thank you very much everybody for attending. We really appreciate it and for the work that you do and such rich contributions. So we hope you have a good evening wherever you are and we'll stay in touch. Thank you.
Thank you.
Thank you.
Thank you. Bye.
Thank you so much.
Thank you.
Again.
Bye.
Thanks everyone, really interesting.
Thank you. Bye-bye.
Have a lovely Christmas.